Arzhan Surazakov, doctor trained in the United States, is a research scientist. He was born in southern Siberia. He was educated in the United States, and he lives in Chile. He's quite an international man, multilingual, and he joined a group of like-minded researchers at a company called Radiant Life Technologies. And in his search for a life-supportive vision for science and technologies, things that support life with technology, not take away from life force with technologies. I can say that of all of the speakers that Kimberly and I have had the pleasure to work with over 15 congresses, by asking people to communicate with us in a timely manner, to turn in their lecture notes, or to even answer what they'd like to have for dinner at the banquet, Arjan has been the most phenomenally responsive person of any speaker we have ever had in 15 years. We send an email, I swear he must be right there watching all the time. Remember we were talking about you want to text back right away when you send one? You want an email? You could almost set you, in 10 minutes he's got a reply. And it doesn't make a difference if he is in Florida at Ed Condrat's microcurrent conference, or if he is in Chile. He is right there with a response for us. Now, I just can't say enough, but you are just in his soul. That's the most important. I could read all these wonderful things that everybody doesn't accomplish, but the essence of Arjan, the gentleness of him, and the depth of his being in this lifetime is truly profound. And that's really his best credential. He is an amazing being of light, sharing his love with us in physical form. Arjan?
Thank you. Thank you. Is the sound on? Okay. Thank you, Dr. Basic, for such kind words. It is a great honor and a huge pleasure to present our technology. My friends Avril and Garrett Murin from Canada, and my friends all over the world who joined us together at Radiant Life Technologies. Today I'll be talking about Coherent Multi-radiance Therapy. But before I start, I would share a little bit about my personal journey, because my background is a bit different. I came from Russia. I studied at University of Idaho. I got my PhD in geography. And I was studying global climate change. And here I'm collecting snow samples in the mountains of Central Asia. I loved this research. It was fascinating. But for me, I could not connect how my papers, academic research, what's going to happen in 50 years will reflect right now. And I couldn't see it. So at some point, I participated on a course organized by Institute for the Study of Men in Spokane, Washington. And there I met this amazing group of people who work on themselves, and through this, trying to make a change. So at the course, I experienced a very powerful shift in awareness, a healing shift in my relationships towards my father. And I felt it very strongly, emotionally, mentally, and physically. So I felt, oh, must be for real. And through that institute, through other courses, I met this group of people who had the technology, Coherent Multi-radiance Therapy, or abbreviated as coMra-Therapy. And these people founded a company, Radiant Life Technologies. So as soon as I saw the device, I have it right here. This is the delta laser. That's all to it. It's a very simple device. I saw it, and I saw the first clinical data, and I thought, this is amazing. This is something I would like to devote my life to. So I quit university, I left life behind, went to Chile, and since then it's been an amazing journey every single day. So what is coMra-Therapy? coMra-Therapy is a dynamic vortex of 4 energies. We have near-infrared laser, ultrasound, color LEDs, and magnets hidden under the plastic cover. So we took 4 existing therapeutic modalities that are well established and put them together into one small compact device. Now, because this technology works on a cellular level, the most fundamental processes in the body, the delta laser can be used to treat whole body, from toes to head, and both treat animals and humans. But my personal sort of aha moment happened during my expeditions in mountains. I was in Andes. We flew on a small airplane to 4,000 meters, 12,000 feet. And the next day we hiked up to 5,000 meters, about and half, so 16,000 feet. So, and from experience, I had climbed for 20 years. I knew it was going to be punishment without acclimatization. There is oxygen, about 50% of that at sea level. And the headache is tremendous, the weakness, the fatigue, all the symptoms of high altitude sickness. So I brought my Delta with me, and I wanted to try and see what effect it will be on me, because I was generally I'm very healthy, and I couldn't tell. I just put Delta, I feel nothing. So on the next day, we hiked up to 5,000 meters. I developed headache, and then I put Delta. In about 8 to 10 minutes, the headache was gone, and I felt energy. So it was incredible experience because I did not use oxygen. I didn't use painkillers. I just put Delta on my brain and irradiated my blood. So there was something real behind this technology, something happening at the biochemical level. So, and that got me interested, and I started doing this research. Now, but before I talk about biochemistry and all the processes, what's happening in the cells, I want to address something what I call principles of life and how they're reflected in holistic medical science and technology. I feel it's a very important point to start from. The first and most probably important principle of life is that life is a regenerative process. Every second, cells of our body busy regenerating themselves. So in the arts of healing, this principle is reflected in this concept supporting the healer within. What does it mean is that the body has enormous intelligence of not just how to maintain the balance, the homeostasis, but also how to heal itself in times of crisis or disease. So there is the intelligence in the body. Now, but if we take this principle, support the healer within, and we consider medical technology, what we need to do is to support the diseased cells. We need to provide necessary stimulus so that the cells can do best what they're supposed to do, which is healing themselves. So this is how we approach healing, by providing what disease cells needs. The very first need of any diseased cell is energy. What do we feel when we get sick? We feel tired. We want to rest. And that has been spoken today. Oxygen and glucose provide the raw material to generate ATP in mitochondria. And that molecule of ATP is necessary for every function in our body, working of the immune system, firing electrical signals in the nervous system, digestion, muscle contraction, and so on. Now, but we recognize the importance of ATP, and it's common sense. But at the same time, in allopathic medicine, disease is still seen mostly as a structural pathology or biochemical pathology. So there's something wrong with the structure, and we need to fix it in some usually forceful way. This is a nice illustration I found. It was made in 1927, but we're still there pretty much in allopathic medicine. But living organisms are a continuous flux of energy all the time. This is a snapshot of a dynamic flow of these rainbow colors in a living worm. So if this worm would be dead, structurally it would be the same, but all this flow of colors will disappear instantly. There will be no flow of energy. So we need to consider energy in the disease. So specifically, this is a nice example. They took blood samples and they analyzed ATP levels in red blood cells. So this, in blue color, you have a distribution, a very nice distribution of ATP of healthy people. And in the red color, this is in patients with chronic fatigue, arthritis, lung cancer, and prostate cancer. So these people, chronically ill people, have very low ATP, not just obviously in their blood, but throughout the whole system. So what can we do to stimulate ATP synthesis? We can take supplements, nutrients. I think that's a very good approach. We can reduce our expenditure of energy, but also we can provide very gentle stimulus for the diseased cells. This research has been done mostly in early 90s, late 80s, in Russia, Eastern Europe. So with laser, they took cells, put them in the Petri dish, and applied light. Nothing but just very low dose of near-infrared radiation. And you can see after they switched off the light, how the amount of ATP increased up to 70%. Again, no extra stimulation, but just light to those cells. On the left is an example of how the same effect of same magnitude can be achieved with weak magnetic fields. So buff light and magnetic field can provide stimulation of mitochondrial activity of ATP synthesis. The previous screen was example with cells, and this is example on the living organism. This is an experiment done with ATP in the brain after stroke. This was published in the Brain Research Journal. So this is a healthy brain level of ATP. Immediately after stroke, there is a drop in energy in the brain cells, almost by half. So it's a critical condition, brain is dying. Then they took laser, near-infrared laser, applied it transcranially, without drilling holes, without injections, just light. And look at this. We have actually up to 70%, again, enhancement of the content of ATP in the brain. So when I found this paper, I thought, oh, that's why. When I was up in the mountains and I suffered this terrible headache, I put delta and I felt such relief. It was amazing. So this paper was really nicely confirming how delta laser worked. And the good thing is that it's not just the brain, obviously, is that laser and magnetic field can penetrate deep in the body. So we can treat directly internal organs, cartilage, deep layers of muscles, any tissue which is lacking energy. So the origins of the low-level laser therapy was established in the 1960s, very soon after discovery of lasers. They found out that if you apply low-level laser to the wound, it actually accelerates healing. So by now, LLT is established worldwide. There is more than 100 double-blind clinical trials. It is established clinical modality. Now, in Russia, they took it one step further. In early 90s, they invented magneto-infrared laser therapy. They found that if you combine the two together, the efficiency would be so much higher. you have this big table. I don't want you to read these numbers in your transcripts, but I wanted to show just an example, is that MIL therapy, magneto-infrared laser therapy, in Russia is a mainstay of official medicine. Every single hospital and clinic and most of private practices have these devices of one variation or other. They have magnets and infrared light. So this is why we have in our device infrared laser here and the magnets under the plastic cover. We provide energy directly to the cells. We stimulate ATP synthesis. Second need of any diseased cell is the message. We know how it works. The messages travel through the nervous system. The target cells would release messengers, chemical messengers, to affect certain aspect of the physiology, or it could be endocrine signal. Released by endocrine gland. So we know these two methods of delivering a message, but if we add something artificial into the body, again, we're having a risk of messing up the very gentle balance in the chemistry. So what else can we do? How else we can deliver this healing message? And that's light. With light, we can provide not only stimulation of energy synthesis, but also a healing message. So in this experiment done by Professor Juanita Anders, they took neural stem cells. They put them, again, in a Petri dish, and they see what's going to happen after 1 week of cultivation. So in the control group, they had no additions. So it's just the stem cells by themselves. And after 1 week, there was no development. There was still immature stem cells. In the second group, they added special chemicals called the growth factors. And these are chemicals that stimulate, they send the message, they bind to the membrane, and they trigger growth maturation. You can see all these dendrites growing. It's a normal process. In the third group, they shine near-infrared light. And again, they did very extensive analysis, and they show that the action of light was actually very similar as chemical growth factors, except there was no any invasive procedures, just shining the light. And if you look in color, on the left we have chemical growth factors, and on the right you see this beautiful neuron busy growing dendrites after application of just light. So with light we can actually talk to cells, and we send a particular message. What message? What happens when we experience color? This is a painting of my father of mountains in Altai. This is where I did my PhD, climbing those glaciers. So when I look at his paintings, I feel what he felt at that time while he was busy painting and I was busy climbing those glaciers. Because through color, we can actually feel something that the artist felt at the moment, and he was putting his feelings into color. So color has this strong impact on our psyche and physiology. On one hand, we have thoughts and feelings. They generate certain emotions. Those emotions, through neuroendocrine system, influence our physiology. Now, color has a very similar effect as emotions. And if we want to, we can actually map it in a very straightforward way. There is one pure emotion, which is desire. And 4 aspects to this emotion. Anger corresponds to red color. It's desire for clarity. I want to achieve clarity. What's going on here? The blue color corresponds to melancholy. This is desire to change. Yellow corresponds to joy, desire to live, and fear corresponds to green color, desire to retreat and reassess the situation. So this knowledge is actually actively used in color therapy called syntonic phototherapy. And here Mary Van Hoy, she is the president of called syntonic optometry. And this is what they do every day in their practice. They actually use red color to stimulate sympathetic nervous system, the fight or flight response. They put goggles or you look in a special box. They use blue color to stimulate parasympathetic nervous system, rest and digest. And the combination, the intersection between the vertical axis would be physiological balance in the yellow-green color. So with colors, if we want to, we can deliver a very specific message to your nervous system, and the body will interpret it in a very intelligent way. So in coMra-Therapy, we took it a bit further because we developed two universal messages. When these three colors applied in this particular sequence, red, indigo, violet, yellow, green, this is a universal message of regeneration. This color sequence stimulates rejuvenation, enhancements of the existing tissue. Two very different messages. And this is why we have in our delta laser the color LEDs, the flash color in sequence. The third need of a diseased cell is gentle mechanical agitation. When cell is diseased or structurally unsound, it's busy in the healing process, regenerating itself. There's a very intense exchange of chemicals, and mostly they are all facilitated by enzymes. So with ultrasound, what we can do is we create a very gentle mechanical agitation that creates a particle streaming effect. So we enhance the speed of this process of all the enzyme-assisted chemical reactions in the cell. So the action of ultrasound is to provide very gentle mechanical agitation inside the cells. So when you put together these four radiances, there is emergent synergy of these four radiances together. And for example, if you combine infrared laser and magnetic field together, their combined effect is by at least 10 times more efficient when applied individually. And again, there is research, there is biochemical evidence that shows this. So when you combine color LEDs and infrared laser, these two together stimulate neurochemical messaging. And we stimulate metabolism by using magnetic field and ultrasound. So there is emergent synergy when we apply all four radiances at the same time to the same volume of tissue. And this is the key point. This is why we call it Coherent Multi-radiance Therapy. Now, when we come to implementation of this principle, of this concept, there is a very fundamental principle of life, which is life is self-sufficient and self-sustaining unto itself. And in the arts of healing, we know that the only true way to truly empower others is to help them to help themselves. We cannot do the work for them. They must have the desire, the intent to get healed. Yes, we'll give you the tools. We'll encourage you with everything we can, but you need to step forward and claim that space. Yes, I want to get healed. So this is why we implemented this concept of coMra-Therapy in this device, delta laser, which is completely safe. We can treat newborns, pregnant, old people. It is very effective and versatile. You can treat the whole human body. I will share in the rest of the remaining half hour some example cases. It's always a difficulty to choose what to present because we treat all these conditions. So I will just select, it's random selections, maybe my personal preferences. The first case is chronic migraine. I wanted to see, because I felt such a great improvement of my personal headaches, what will happen to primary headaches. Because on one hand, we have secondary headaches caused by, for example, hypoxia or drinking too much wine, for example. And then, on the other hand, we have these primary headaches, which supposedly don't have any pathology at the basis. So this lady, she had migraine for 20 years. She had 1 to 2 attacks every week with very severe pain, each lasting 1 to 3 days. The pain-free days were scarce, and she was on a point to be hospitalized because she was taking triptans every other day. Very, very difficult. This is a treatment. You just simply put delta laser on your head, according to a user guide, and she was doing it twice daily at home for 7 weeks. This graph shows your diary. She was recording daily maximum of your pain. So we start from 0, no pain, to 10, maximum pain. So when she started using delta laser, she was 10 out of 10. And that's her usual week. By the end of the second week, she started noticing something's happening. I feel less tired, I feel less fatigued, and my headache's actually going down. After 7th week, she was pain-free. She stopped taking all medication. She was, to all intents and purposes, cured. Now, this is not a single person. We have a case series of 10 people, which we did, and 3 of them with about this level of pain had this improvement. Now, it's not that simple because behind the ATP dysregulation in the brain, there's also a true cause of headaches, of primary headaches, which is feeling bad about myself. It's either shame, it's guilt, it's feeling unworthy. So those emotions, those feelings create the very intense processes in the brain, and that's why they suck in all the energy, the chemical energy, the ATP. So it's not as simple as just putting delta. You also have to go through certain transformation. But with delta, we address the physical side. So if we sort of help you with the pain, once you're free of pain, you need to work on your behavior. Because unless you change it, as one person who had in Chile, for 9 months he was pain-free. And then attacks came back. And I told him back then, you need to work on your personal issues in your family. I wrote 3 articles and I published in our Journal of coMra-Therapy where I described this process. Second, this case was presented actually 2 weeks ago at the Microcurrent conference. And I thought I'll include it because it's Iridilogy. This is a patient. She was diagnosed with retinitis pigmentosa. This is when we lose our peripheral vision, and these people become blind. She was also HIV positive. She had diabetes type 2. Dr. Lori Chaikin, she used a combination of microcurrent and delta laser. Some symptoms, her visual fields were severely reduced. She had a great difficulty navigating around the corners because she couldn't see anything around her, just a tunnel, like a very narrow tunnel that she could see. So she was trips and stumbles frequently. So this doctor, she used a combination of microcurrent and delta laser 2 times weekly. That's a treatment protocol with delta laser. We treat the brain, over the eye, over the optical nerve. Now, after 18 treatments, this lady, she experienced much better ability to navigate. She was actually able to, not to grasp the rails in order to go down the stairs, but she could actually walk freely. It was for her very, very significant. So when they start measuring the visual fields, this is what they found out. So this extremely severely reduced visual field, 5 to 8 degrees, very narrow. This chart shows sort of the width of your visual field. And after 18 treatments, your visual fields expanded drastically. And with RP, there is no cure as far as I know. So it was an amazing example, and she reported this case at this past conference. Third case I would like to spend a bit more time is on multiple sclerosis. not just because of the extent of the healing that we observed, but also because it's such a difficult condition. And because we continued observation for about 4 years with this lady. She had strokes in 98 and 99. She was diagnosed with multiple sclerosis in 99, and she had a relapsing remitting type. It means that from time to time she had these attacks, which resulted mostly in permanent damage to her nervous system. And she started using delta laser at home, treating herself in September 2010. Her symptoms before coMra-Therapy. She had both chronic and acute pain. Chronic pain was pretty much always present. She felt radiation down the arms, legs, and face. Acute pain was in the forms of shooting and sharp shocks in hands, face, and back. She also had something called MS hug, when the pain was enveloping the abdomen, very intense pain. She experienced numbness, pins and needles, and a lot of skin pain, pain to touch. She was deaf in the left ear and blurred vision. The second most bothering aspect was fatigue. She was always tired, no energy. She had loss of muscular strength in both hands and arms. She had a great difficulty walking. She used to have a walking stick all the time. And actually, she couldn't even finish washing dishes in the kitchen. She would have to sit on a chair in order to complete the chores. She was that tired. She couldn't digest properly, and she was choking all the time with the food. She had arthritis and limited movement in the left hand. She had a coronary heart and inappropriate sinus tachycardia, high blood pressure, and very high output of bile. She used about 6 different drugs every day. Once per week, she was taking morphine for pain, and she participated in 2 different clinical trials for MS drugs. So she was under constant observation by a local hospital. This case comes from South Africa, where our representative, Charles Mitchley, he was working with this lady over the phone mostly. So how do we treat multiple sclerosis? It's a systemic disease. It's not localized in one spot, so we can put delta there. So this is a user guide, coMra-Therapy user guide, where we put together general guidelines how to approach treatment of the body. And I feel this is where the knowledge of Iridilogy can come into place, because if you identify which organs, systems are involved in this disease, then you just open the book, you locate the place, you put delta there in that spot. I think this is a very interesting to explore. So for multiple sclerosis, we have a treatment. It's neurology 10. It's a very long treatment, 1 hour, 39 minutes. We split it into several halves, several parts. You start in the morning. You would treat, it's Universal 5, it's the name of the treatment, which addresses mostly nervous and endocrine system. So you place delta on your head, heart, sternum, and you would stimulate your adrenal glands with delta laser. So you do this first thing in the morning. Second part, very important, we do non-invasive blood irradiation with delta laser during the midday. So you put delta laser directly over each major artery of your body. So we irradiate all the volume of blood because we increase activity of the immune system, we increase oxygen carrying capacity of the blood. This treatment, Universal 3, is also very important for any infectious diseases. Flus, colds with this treatment. Midday, you treat heart. You place the delta laser on the heart from front and the back as well. Per point is usually 1 to 2 minutes. Evening after dinner. This is Universal 4. And this treatment is best for athletes, sportsmen, physical workers who have a lot of physical exhaustion. So here we focus mostly on the digestive system. Again, we treat the blood. and the peripheral nervous system and the adrenals. And you also treat directly the spinal cord, because in MS, obviously, we have a loss of myelination of the nerves is there. Results. Very soon, after 1 to 2 treatments, she started to feel something. It was very unusual for her. So when I summarized your diary, because you asked you to keep diary every day, apart from your clinical studies and the clinical trials. So after the first week, she was able to sleep through the night for the first time in about 10 years. No stomach pain for the first time in about 7 years. She was able to go out to do the gardening without falling over. And she walked in the kitchen without using chair. So around that time, she started to participate in a new clinical trial for a MS drug. And she developed very strong headaches and other severe symptoms. So she was very scared. What's happening to me? It could be delta laser, it could be drug. So she stopped using delta. She was very scared. But despite stopping the delta, the symptoms actually become worse and worse and worse. So after 2 weeks, she resumed treatments with delta laser, and headache subsided. Energy levels rose up again. So she, oh, okay, so if I use delta laser, actually I improve my condition. And she continued since that time using delta laser for the last 4 years. After the first month of treatment, she stopped using all medication, all pain medication, except she still used for blood pressure and that trial drug that she was signed up for. She was, for some reason, still taking it. Day 51, she noticed whenever she put delta, her headaches would subside immediately or within a very short period of time. Her stomach pain also would disappear very soon after using the delta laser. Her arthritis of the left hand was gone, and her bile count went down by 30 points. About 3 months of treatments, she was able to handle the heat of summer months. Headaches completely stopped, no excessive fatigues, and no muscle weakness. So her improvement continued to increase. She did have several relapses during these 3 months, but we encourage you need to continue, treat yourself with delta laser, and every relapse would be shorter in time, and the magnitude of the relapse, the intensity of pain, all the symptoms would actually, every time it will be smaller and smaller and smaller. So she persisted, and she used delta laser on and on. 1 year, 4 months. She noticed she could take longer rest breaks between the treatment courses. So she would take 1 week rest periods. Now, because she was observed in this clinical trial and they did a whole battery of tests on her, bile count was normal, blood sugars, cholesterol, vitamin D, phosphorus, blood pressure, all within normal levels. A side effect, she lost weight. She had carried a lot of extra weight, and she also didn't have any craving for sugars. She was able to work full day since that time, and she resumed her exercises. She loved Pilates and yoga. 2 years, 6 months. Now, she continued a reduced program. She used delta laser for, according to program 2, 4, and 5, which is stimulation of nervous system, digestive system, and endocrine system. And she was able to take longer and longer breaks with every month. Headaches did not came back. Sometimes pain would come back, sharp pain. She would take medication for the pain to manage it, but it was very short periods of attacks. She also noticed she didn't have infections for about 2 years, although in the past she had it all the time, colds, flus, gastric infections. So she had no infections. So before the microcurrent conference, about 2 weeks ago, I asked Charles in South Africa to contact her again and get her feedback what's going on for the last 4 years. So she wrote a big email. She felt strong, experienced no fatigue, no anxiety, no headaches. Her slurry speech and stomach problems completely disappeared. Because she was observed in hospital, they noticed improvements in psychological and cognitive testing, hand-eye coordination. All blood tests were normal, but she still suffered with her left leg, and she was still deaf in the left ear. And she maintained a reduced program during treatments in the morning and in the evening. So with delta laser, we don't just reduce pain or we manage pain. We regenerate tissue. And this is just one example, or maybe the most difficult example of regeneration of nervous tissue. But I also have other cases to present on regeneration of wounds, bones, muscle, connective tissue. And this part I just copied from her email. She now leads an extremely active life. She gets up at 6:30 all day on her feet. For the past year, I have been teaching autistic and Asperger's students cooking on a full-time basis. We are presently in search of premises to expand the business due to the demand, and also opening a production kitchen so that we can create an environment where these individuals are able to come to work each day to do something fun and interesting, earn money, and self-worth. Most of them remain at home throughout their adulthood because they're not accepted in general. So for these 4 years, we saw a transformation from someone who used chair to wash dishes to someone who is running this organization. There is a website, coMra-Therapy.com, general introduction about our technology. Journal of coMra-Therapy. We made this journal, we publish it online only, and this is where we collect case reports and science articles on coMra-Therapy. Various different applications, so I encourage you, once you have your experience with delta laser, submit your case reports to us. Radiant Life Technologies, it's our website for more information, and Institute for the Study of Man, where you can learn more about emotions, behavior, and true causes of diseases. And also see us at our booth. We're glad to talk.